Welcome back to another podcast with NutraScience Labs. I'm Blayney McEneaney, Vice President of Sales. I also have Bruno, Vice President of Scientific and Regulatory, along with Ryan Gillen, our new Business Development Manager. Today we're going to be talking about men's health. Great category, something I think myself, Gene, and Ryan, of course, there's just always some great questions around the topic. I think to start, maybe we can start off with just, when we think of men's health, I'll kind of go to Ryan first. When you think of men's health, like what is the very first thing that just comes to mind when you're thinking about it?
I mean, I think a lot of it comes with, testosterone.
Yeah.
Just because, as you get older, it decreases and you want to keep exercising. So I feel like, reduction in testosterone is a big concern for a lot of men.
Yeah, and I think Gene, kind of carrying that into the dietary supplement category, one of the things I've seen, I've been in the industry for 15 years. You obviously a lot longer.
What? You saying I'm old?
Yeah, I mean, if the shoe fits,
Yeah.
But on a serious note, you think of how that carries into our industry. 15 years ago, when I got into the industry, it seemed like testosterone was a category that was absolutely booming. It was everywhere. Sports nutrition and men's health and testosterone just kind of seemed really cohesive, and now I feel like it's a category that I wouldn't necessarily has gone away, but it's transformed a little bit.
It has transformed. So when the testosterone became something associated with dietary supplements, in the beginning it was a sports nutrition.
Yeah.
Then it transitioned and it became, middle-aged guys, and the fact that they have a reduction in testosterone, and how that affects them, and how that affects their health, and how they have a lower sex drive sometimes, or they have lower energy levels. Their bone mass can decrease. Their weight they can start gaining weight. There's a lot of areas affected by a reduction in testosterone, and so the guys that really need help with that are really the middle-aged and up, not really the young guys.
Yeah.
And so that is kind of the shift I think you're talking about with the age range. It changed the nature of who buys that kind of thing, and that is something where and also those are the guys that are really going to notice the difference. For a well-formulated product to help them with their testosterone, they're going to notice the difference far more than a young guy who's already producing a ton of testosterone.
Yeah.
What's like the age that you would start saying, like, this is when you might start seeing things?
Okay, so let's be clear. About age 30-ish, there's about a 1% per year decrease in your testosterone production. Varies from person to person, some a little more, some a little less, but that's when it starts. Where you're going to be noticing it is somewhere between 40 and 50, just depending on the person. Then you start going, oh, yeah, and you may notice it from, the most common thing is just a decrease in energy levels. I just don't have the energy, you start to get grumpy old man syndrome, and or you notice, your sex drive is just not what it used to be. And those are things, or you're gaining weight more easily. These are things you start noticing, and you don't necessarily associate it with testosterone. Maybe the reduced sex drive you might, but the other things you don't necessarily say, oh, that's a testosterone related issue, but often it is. And to be clear, you don't have to have clinically low testosterone. Let's say you have a range of, depending upon your age, there's different testosterone ranges that are appropriate for your age group. Let's say your testosterone range that would be healthy for you would be somewhere between 200 and 500, let's just say. But you can be sure that the person who's around 500 feels a whole lot different than the person who's around 200, right? That level, that difference is very profound. Sometimes just having a 15% increase in testosterone can make a big difference. And so even if you're in a normal range, if you can increase it a little bit, that little bit can make a huge difference in how you feel and how you perform in life in general. And so I was actually lucky enough to be involved in the formulation of a product that was the very first testosterone product for middle-aged men, back some years back. And it kind of took the industry by storm because it was just a whole new thing. And I can't tell you the number of testimonials we got from guys who were using it and just, wow, it made such a difference in their lives.
Yeah, for those people who are dealing with that, what are those specific, ingredients or supplements out there that they can take to help them with their T levels? I mean, I know it's not going to make them go from 200 to 900.
No, it's not.
But it's going to help out a little bit to do something.
It will. Now let me be clear. A dietary supplement, whatever the ingredient is, the best ingredient isn't going to have the effect of getting testosterone therapy. Testosterone therapy, you can go, many times the level that you have now. A good ingredient, a good nutraceutical to help testosterone might be somewhere between a 10 and 20% increase, something in that range. All right. And while that may not sound like a lot, it is. It's significant enough to make an impact. All right. And even more importantly, it's a safe amount. All right. You're not screwing around with amounts of testosterone. I mean, if you're under a doctor's care, it's a different issue. But we know there's a lot of people who will use testosterone and they're not under a doctor's care. And there are ramifications if you don't know what you're doing and how to do it. One of the biggest ones is people don't realize when you take straight testosterone, if you're an injection or whatever, it will convert into something else. It can convert into DHT, dihydrotestosterone, and it can convert into estrogen. And those can be a problem. Not only does it cause your testosterone to lower, but they have their own ramifications, which is why if you had low T and you went to a urologist, they'd say, okay, we're going to give you this testosterone injection, and oh, by the way, here's a prescription for Arimidex or anastrozole, which is the generic form. It's an anti-aromatase, meaning it'll prevent the conversion of testosterone to estrogen. Because you don't want to be a guy with testosterone, now suddenly your estrogen levels are rising high. That's not a good thing for a guy. And so there's things that, if you're under a doctor's care with testosterone, great. If you're doing it on your own, you damn well better know what you're doing. And if you're using a supplement, you don't have to worry about it because you'll never get to those high levels that are going to be dangerous if you don't know what you're doing. So you asked about ingredients.
Yes.
All right. So one of my favorite, and we've talked about it before in other podcasts, is ashwagandha. All right. As I've mentioned before, ashwagandha is an adaptogen, helping your body to adapt to stress. But there is a body of research showing that somewhere in the vicinity of, well, again, depending upon the extract that you're using, somewhere in the vicinity of 600 milligrams of a good full spectrum ashwagandha extract can actually help increase testosterone levels like 15 to 17%. Very meaningful. Not just a single study, multiple studies demonstrating this effectiveness. And not only is it very safe, but the use of ashwagandha has other benefits, stress benefits, other things too. And actually, ashwagandha has also shown, not surprisingly, benefits in men's, with regard to sex drive, with regard to energy, with a number of areas. But it does have that effect on testosterone. So it's a really good ingredient from that standpoint, and I like it a great deal. Another one that's interesting is called shilajit. You got to say that correctly, otherwise you're gonna get yourself in trouble. Shilajit is actually sort of generically called mineral pitch. It's actually a material derived from rocks. This kind of
it's like a tar.
almost like a tar-like material.
From
a resin, thank you, from rocks. Resin sounds a lot more eloquent.
Yeah, I imagine you wouldn't want to take
now,
a tar somewhere.
the shilajit, often it'll come from the Himalayas.
Right.
The Himalayan mountains where it's kind of pristine there, and you get a nice material. And you want a good material if you're using shilajit because you want to make sure it doesn't have all these heavy metals and all that. So you got to make sure you go to have your product made at a contract manufacturer who knows the right stuff to use and will avoid the crap stuff that is going to give you heavy metals and just has the good stuff. But studies on shilajit show it'll have a similar ability to increase testosterone, maybe even as high as like 23%, again, which for a supplement is pretty good. And shilajit also has some adaptogenic qualities, and they even found it to be good for increasing ATP levels. They can actually measure increases in ATP, so energy.
Yeah.
Nice thing to go along with testosterone, right? So that is another very valid ingredient that could be used in a few different dosage levels. None of these are going to be in grams, they're all going to be in milligrams. Now, Uricoma longifolia, which is not an Ayurvedic, a traditional Chinese herb, goes under a lot of different names. Long Jack is another one.
That's the one I know.
And there's other names for it. And there's also certain extracts that have been well studied. And anywhere from 100 to like 400 milligrams of this extract has been shown to have some pretty good effects on testosterone levels in men. Again, interestingly, it has adaptogenic qualities.
Right.
All right. So you're seeing this theme running throughout where you have things that are adaptogens that also increase testosterone. And that's been shown to increase testosterone in multiple trials at different levels. Some substantially higher, but I think the good trials that are more reliable are still in that sort of like 15 to 20 some odd % range and showing effectiveness. And again, at a slightly lower amount than some of the others, but then the extract's a little higher cost too, so, you know.
So as you're going through these, sorry to cut you off.
No, go ahead.
We're talking about all these different ingredients. Is it a crazy idea as you go through these that these would all be in one formula, or are some of them?
No, that's a good question.
Yeah, choose these or choose these.
That's a good question. Some of them can be combined together. For example, one that I didn't mention yet, and may or may not be a surprise to people watching our podcast, is vitamin D.
Right.
Men with lower levels of vitamin D make less testosterone. All right. And you know what the prevalence of vitamin D deficiency is in our nation? Well, there's deficiency and there's insufficiency. Slightly less than half of Americans have vitamin D deficiency, and almost 80% of Americans have vitamin D insufficiency.
Right.
They're just not getting enough. And it's just so common. But those lower levels, how can vitamin D have an effect on testosterone? Well, besides the fact that there's vitamin D receptors throughout our entire body, including the areas that make testosterone, people don't realize vitamin D itself, its structure, its chemical structure is a steroid. All right? Is it a steroid or is it a vitamin? Yes, it's both. Its chemical structure, it has a cholesterol backbone and it has certain things that make it a steroid, but it acts as a vitamin. Okay, but because of its structure and how it is, your body uses it in helping to make testosterone. Okay, and if you don't have enough, your levels drop. In studies where men had low levels of testosterone and they used like a little over 3,000 milligrams, 3,000 international units of vitamin D, their testosterone levels went up significantly because they weren't getting what they needed to make it. Now they were.
Right.
So you could easily combine that amount, I think it's 3,332 IUs or some odd amount like that, and you combine that together with one of these other adaptogenic ones, absolutely, you can have a really good effect on testosterone. Could you also include some shilajit, or could you ashwagandha, whatever? Yes, you could combine. You don't necessarily need all of them, and if you did, it would be a very expensive product.
Yes, very.
But at least one of those ones combined with vitamin D would be a fantastic thing to do. I mean, there's other things you could look at, but those are sort of, for me, the biggies in terms of their ability to have a reasonably profound effect on testosterone levels. Now, being the old guy of the group, I just want to let you know, there's more going on in men's health as we age than just the testosterone. One of the other areas that's a big concern is prostate health. And I mention it, well, because it's a big area, but also there's some relationship to the testosterone story. I don't want to go into that just a bit. So if you don't mind, I'm going to go on a tangent there.
Please do.
So when men age, it's almost 100% sure they'll have some enlargement of their prostate, which in and of itself isn't necessarily bad. But here's what happens. Picture the prostate as kind of a donut-shaped gland, all right? And through the prostate runs the urethra. the tube through which urine flows. Now, if your prostate starts to get swollen and enlarged, it does it on the inside too. So here's your urethra, and it starts to squeeze it, which means, oh, that's going to affect your ability to urinate. You may have erratic urination, painful urination, frequent urination,
Weak stream.
a weak stream of
Yeah.
urination. All of those things will go along with it. And the older you get, the more enlargement you get. Now, for some men, it doesn't enlarge to a place where it affects the urethra and has that effect. And in many others, it will. And it's a pretty linear thing as you age. It's like 60% of men in their 60s have prostate enlargement, 80% of men in their, and so forth. I mean,
Yeah.
it's linear. And it's a problem. And one of the biggest problems is the prostate enlargement will affect men when they're sleeping at night. They'll wake up urged to pee.
Yeah.
Because it's holding on, and they'll go and they just get a little dribble in it and what happened, and they wake up constantly and need to pee. Their quality of life goes down because of this constant need to pee, and at night, because they can't get full bladder emptying.
Right.
Because it's holding it, and then suddenly it lets up, and gotta pee all at once, and it can be a miserable situation for guys who are going through this stuff. But the good news is there are nutraceuticals that can help with prostate health, that can help with this frequent urination, erratic and the more complete bladder emptying, the whole 9 yards. Okay. Now, I mentioned testosterone, and I want to get the relationship to this and how this affects. So testosterone can convert to a couple things in the body. One of them is dehydrotestosterone, or DHT. DHT is implicated in prostate enlargement. You got more DHT, you're more likely to have more of an enlarged prostate. You reduce the amount of DHT, you're less likely to have that degree of prostate enlargement. So, what can you do that's going to help with that situation? Well, there's probably the sort of the granddaddy of the herbs for this is saw palmetto. And saw palmetto is a lipid extract that's used of the berry. And there's been dozens of studies showing effectiveness of saw palmetto. Typically it's standardized for around 80 to 90% fatty acids. And the clinical dose is 320 milligrams. And this stuff works quite well. And what it does is it actually inhibits an enzyme that is involved in the conversion of testosterone to DHT. Okay, and so you tend to maintain your testosterone levels better and not have as much DHT. And in multiple studies, it's been shown to help with prostate size, all of the urinary symptoms that we discussed. I mean, really, some seriously good results on that. Now, another ingredient that has a similar type of effect is beta-sitosterol, which can be derived from different sources, pine sources, soy sources. And it's a sterol, as beta-sitosterol suggests. And there's at least 7 good, solid human clinical studies showing effectiveness of this. Does the same kind of thing, reduces that conversion, and has some of these same wonderful effects at reducing that increase in enlargement and reducing these urinary symptoms of having all these just wonderful benefits. And I've seen some companies out there base their whole company position on that ingredient,
right,
because it's been so effective at helping to address these symptoms. And for some guys, it's like a new lease on life. It does so much to help. Another one is like pygeum. It's a bark material from Africa, and again, it actually has sterols in there. It actually has beta-sitosterol and some other stuff. Similar effect, 100 milligrams or more. Although that one's a little bit harder to come by these days. And the first two are much easier to come by, and works, fabulously well. And I mean, there's a whole lot of other ingredients, but one of the ones I wanted to mention again, keeps popping up again and again, is vitamin D.
Yeah.
They found that men with lower vitamin D levels have more prostate problems.
And can you connect both the ingredients from Prostate Health to low T and add them together in one product, or would you say separate those and
So,
put them in different products and take them at different times?
you can, but I think there's a little bit of a disconnect for some people in regard to that, because they know that testosterone, testosterone's a problem with prostate health. Well, it's really less testosterone and more DHT,
Mm-hmm.
but some people will fear, if I'm taking something for my testosterone, it's going to impact my prostate, if they already have a prostate.
Yeah.
Well, the truth of the matter is, again, that's where when you come into using dietary supplements, it's never going to increase your testosterone to that huge level. And the fact is that it's going to have this marvelous effect on reducing the conversion of testosterone into DHT. You actually maintain higher levels of testosterone because you're not converting it into other stuff. And so the answer is yes, you can combine that. There might be a disconnect. It might be a bit of a marketing challenge to tell the story. But yeah, you can do that.
One of the things you keep mentioning over and over is DHT, and I've certainly heard the acronym before, and I was associated with hair loss.
Yes, you're right. Which leads us to another part of this discussion on concerns for men's hair.
Right.
Men's health is, as men get older, they have more of a tendency to have hair loss, all right? And listen, it's a genetic factor too. I mean, it's not just a nutritional factor. There are genetics. We used to think that it was all associated with the X chromosome and you inherited it from the mother's side. Now we know that's really not true. It comes from both. But yeah, hair loss will occur. And there is a genetic component to it, and you can't change the genetics of it. But there's things that you can do. And there are studies, and not surprisingly, some of the same ingredients, like saw palmetto and the beta-testosterone, guess what? That combination has been studied in men and in their hair and found to actually help slow down hair loss and help to improve quality of hair. Why? You just put your finger on it, Blayney. It's the DHT. You're reducing the amount of DHT that has this impact, all right? And so it makes a lot of sense. Oddly, there is a pomegranate extract. A pomegranate extract, it's called Pominox, and it's standardized in a special way, and it's a really cool ingredient. And a lot of times you'll see ingredients for hair be studied on women. Keratins, extracts, keratin concentrates used in women's studies and showing good for women's hair. But this one was done in men. It was all studied in men. And it found just some really significant effects in men's hair growth and reducing the rate of hair loss and improving the quality of hair for, I forget the exact amount, it was over 300 milligrams daily, somewhere between 300 and 400 milligrams. Really effective for that purpose. And that's something you can combine together with things like saw palmetto or beta-testosterone and have just a really positive effect. So when we talk about some of the areas affecting men's health, you see a thread that goes throughout them, all right? Testosterone, low testosterone, yeah, okay. Prostate, yeah, well there's a testosterone angle in there. Oh, and hair loss, there's testosterone angle in that too, or at least what it's converted into. So when you start doing things to help one area, you might actually help other areas too.
Right. It's back to that balance.
And I want to tell you something. If you're a man and you are and you're on testosterone therapy, okay? Testosterone therapy, I don't need to worry about any of the supplements. I got that, I got it covered. Yeah, that's true, you got your testosterone covered, but there's some things you can do to help. So, remember I talked about testosterone is converted into estrogen. Well, you may be on a Arimidex, the prescription that helps to reduce the conversion in there, but doesn't do anything for the conversion to DHT. So if you can use saw palmetto and beta-testosterone as well, that helps to reduce the conversion, which means that what can happen is if you're getting testosterone therapy And rather than have your testosterone start being converted, it actually helps maintain that testosterone level, keeps it at a high level, because it's not converting to that. And there's combinations of things like saw palmetto and astaxanthin together, that combination has been shown to have an anti-aromatase effect, that is, reducing the conversion of testosterone to estrogen. So those kind of things you can do. So even if you're on testosterone therapy, doing these additional things will have an additive beneficial effect on all of that. And that's a great way to, that's a good example of a complementary health benefit, and in integrating the use of, medications from your doctor and dietary supplements, and how they can work together for better overall health and wellness plan. And we've talked about all these things, but one of the other areas that comes into play here in men, and it's indicative of it's something that happens with low T. We talked about sex drive, but sexual health and sexual performance isn't just a testosterone issue.
Yeah, I was gonna see, just like your T level for activity, is that same thing or different versus for a sperm count type situation for men who have low sperm count? Does that mean that they have low T for activity, or is it the other way around? Just because you have low T that you have a high sperm count?
It doesn't necessarily. Let me just put it this way: if you have low T, the chances of you're having a high sperm count are slim to none. All right, you are likely to have a lower sperm count with lower T. But interestingly enough, for example, we talked about ashwagandha. If you're using the right ashwagandha extract, there's studies on it not only increasing testosterone, but increasing sperm count, sperm mobility, the overall function and quality of sperm. And so that is something that comes into play. Amazing, again, with something like ashwagandha, that's an adaptogen, that it has that effect. And that's a really positive overall health benefit there, especially if you're a guy who's trying to start a family and
Yeah,
I feel like shilajit does that as well.
It does.
Yeah, it certainly does.
People in the office.
Yeah, there was. I think you mentioned shilajit. It was actually one of the first things I think we spoke about as a group in the NutraScience sales team. You came to us with shilajit and explained some of the benefits, and some of them being sperm production.
It does.
And there is certainly some testimonials out there. And
listen,
shilajit babies that
there's nothing like there's nothing like personal experience.
Yeah.
I mean, I'm all about the science and the studies, but that doesn't change the fact that when anybody has their own experience with it, that's all they care about, because it worked.
I think when you told me that story, I had to stop taking it that day.
Yeah, well, you do have to be careful.
Yeah.
And it is such a, it almost segues from men's health into men's fertility, which is a category you feel in this industry that I don't feel like gets a lot of attention. I don't necessarily know why. Maybe it's an afterthought. But if you think about the importance of, like you had said, the sperm count is not necessarily just the number that you care about. It's that mobility. It's that health.
Right. It's all of those things. And the two. So here's the deal. If you're addressing testosterone levels adequately, and you're addressing one other area, which is the circulation that takes place in the genital region to make sure, well, I'll get into that in a moment. If you're addressing those two things to a large extent, not completely, but to a large extent, that's going to help address having a positive impact on male fertility, especially when you're using things like ashwagandha, like we just discussed, or shilajit, like we just discussed. But the other component is this, and this is something that comes with aging as well too, is, so our body produces nitric oxide, and in sports nutrition it became a big thing. Not nitric oxide, you get the pump because nitric oxide has a vasodilation effect, and you get greater delivery of blood and all the nutrients and everything to all the areas of the muscle and what have you. But nitric oxide is what also helps to facilitate the ability of a man to achieve and maintain an erection. Without nitric oxide, you don't get blood flow to the genital region sufficiently to do that, all right? And so, I mean, there's whole drug industries who've made things like Viagra and Cialis that address that for men who have erectile dysfunction. I'm not necessarily talking about erectile dysfunction. I'm just talking from a dietary supplement standpoint about just things that you can do to help that. Because again, you may not have full-blown erectile dysfunction, but you might benefit by some additional assistance, especially as you are aging.
And that could be something you could take every single day to help out.
And that's a difference. You're right. So I know what you're talking about. You're talking about your doctor may say, okay, before sexual activity, take this medication. And so you're taking it on a kind of as needed basis.
Mm-hmm.
Supplements are different. You'll take them every day to maintain a higher overall level of nitric oxide, so when the opportunity presents itself, you're ready. So what can you use that'll help that?
Next question.
Well, there's a few things. The most popular one, or maybe the most well-known one, is the amino acid arginine.
Right.
Arginine will convert in your body into nitric oxide. And so, not surprisingly, you'll find studies showing that it actually helps erectile function, right? Because it increases nitric oxide levels. But, in addition, there's an amino acid called citrulline. Now, citrulline can convert to arginine, which then converts to nitric oxide. And you say, well, why bother with the citrulline? Just go straight to the arginine. Here's why. I prefer citrulline because your body makes arginine. So when you take arginine as a supplement, what can happen after a while is your body says, oh, I'm getting plenty from an outside source. I can start making less. So by taking arginine in the beginning, your arginine levels go up, and then you continue to take it, your body starts making less, and it goes down and reaches the same level it was at before. But if you take citrulline, that doesn't happen. Studies show you take citrulline, you'll actually get higher arginine levels than if you took arginine. Because your body will use the citrulline and convert it to arginine and convert it to nitric oxide. It actually works better for that effect. And so those are things that can work very, very well. Have just a really positive outcome on that. And so now there's some other things too, like
beet powder, I think, is one.
well, beet powder is so there's two kind of pathways for nitric oxide production. One has to do with the creation of nitric oxide through that arginine pathway, and the other is through a nitrate pathway.
Right.
And the nitrate pathway, that's where beet powder comes into play. It's full of nitrates, and by using the beet powder, you contribute to the nitrates, which then become nitric oxide as well. Different pathway, which means you can combine that together with something like citrulline or arginine, and they're working via two different pathways to achieve the same goal. And it's not redundant,
right? Because
they work differently. And so that works. And then there's a really interesting blend of different botanicals that are combined together, and with using as little as 100 milligrams a day. Now, I'm not going to mention the name of the blend, only because if you want to know it, come to us and we'll make a product for it. But this blend's had a published clinical study on it, at only 100 milligrams, increasing nitric oxide levels over 60% with 100 milligrams.
Yeah, that's significant.
I mean, you use that every day. It's even just that one ingredient by itself. Now there are other things too, but those are some of the real main ones. And I think if you go that route, any combination of those things together or any one of them by itself, that's going to help. It's going to improve the nitric oxide. It's going to help facilitate healthy erectile function. And that's a great thing to use in combination with testosterone enhancers too. Yeah. You combine those together, you have a really positive impact on male sexual health and performance.
So then all of these together, you could be taking every day, but they're going to be working better if you do live a healthier lifestyle. You're exercising, eating well.
Let's be clear. You can take all kinds of stuff and lay on the couch and eat potato chips, and you know what? You're going to have a limited effectiveness. Mm-hmm. You have to move. You have to get out there. You have to do some kind of exercise, even if it's just doing some brisk walking. You have to care about your diet and try to eat healthy, do the right stuff. Because if you're doing all these great things, but you're eating crappy food constantly, with sludgy blood because of all the crap you eat, all right, these things aren't going to get to where they need to go anyway, and you need the exercise to help move things along too, and have other effects, you have to put some demands on your body through healthy living that then the use of the supplements can augment. But it's like somebody saying, I'm taking the magic pill to lose weight. I don't know why. I'm sitting here on the couch watching Friends reruns and eating ice cream. I don't know why I can't lose weight. I'm taking the magic pill. Well, that's why.
Yeah.
Same thing with other areas of health. So thank you for mentioning that, because that is important. You have to, dietary supplements are just that, a supplement to a healthy lifestyle. You're eating healthy, you're doing some kind of exercise. It's not enough to just take a pill and say, oh, that's all I gotta do. You gotta do the other stuff too.
Yep.
I think you covered it. I think if we went a little further, we'd probably enter into maybe the anti-aging category, which is, I think, a great podcast for another day.
Yeah.
I think it is a good podcast.
Yeah, so on that note, again, thank you for watching. If you have any questions, please leave them in the comment section. Don't forget to like, and reach out to us with any questions, or if you'd like to have a product made. Ryan, Gene, thank you again.
Thank you.
Thanks.
And we look forward to seeing you next time. Thanks.